everyone. I'm Mrs. Princey, Associate Professor in Mental Health Nursing. I've got a story of this 11-year-old boy who presented with a history of anxiety. That is, the patient experienced homesickness when he was away from the home for a school camp. The anxiety was such a level that it produced so much distress that he even vomited. He experienced this kind of the anxiety as a fear that something wrong would happen to his mother, that she would not be able to return back to pick him up. The patient as well as the mother complained that he would experience a similar kind of a fear, worry, trembling and sweating, and even stomach churning as well as crying. If you take the history of this boy, when he was around 3 to 4 years old, so when the mother used to go to leave him to a preschool, he seemed to be very clingy to such an extent that the preschool teacher used to pray him to just create the physical separation from his mother. Between the ages 5 and 10 years, the patient experienced severe nightmares in which he had a fear that his mother died and he couldn't able to help her out. So at this point of time, when the client or the boy had gone to a camp at school, right? So there was a severe distress that he experienced because of the separation from his mother, and even such kind of a situation caused the school to just call in the parents and take him off from the camp, right? The topic for discussion today is the separation anxiety disorder. So it is one of the anxiety disorders which is mainly seen in the children as well as during the adolescent period, that is less than 18 years of age. So let us see in detail about this disorder, separation anxiety disorder. Separation anxiety disorder is a medical condition characterized by significant distress when a person is away from his parents or any other caregiver, or even for that matter home. So it is the anxiety which is produced in a person when he is away from any of the loved or a caregiver. So that is called as the separation anxiety disorder. So what is the onset of this condition, separation anxiety disorder? Separation anxiety disorder usually begins before the child completes the first birthday, and even it can pop up during the toddlerhood period, especially until the child is 4 years old. But you can also notice the intensity as well as the timing of separation anxiety varies from child to child. Separation anxiety disorder is noted as the one of the earliest occurring anxiety disorder, which usually occurs between the age of 18 and 14 months old, which can even go up to the toddlerhood period or till the preschool period. So it is also noted this kind of the separation anxiety disorder can also go up to the age of 18 years, and even after that, and usually it will last for about 6 months, right? So that is about the onset of the separation anxiety disorder. Moving on to the etiology, why is the child or children developing this separation anxiety disorder? The factors contributing to this can be numerous, like biological factors, cognitive factors, environmental factors, the child temperaments, as well as the behavioral factors. If you take the environmental factors, the environments in which the child is being raised, for example, the parental behavior plays an important role in the separation anxiety disorder. So some of these examples of parental behavior which can contribute to the separation anxiety disorders are low parental warmth, that is the connection, the affection between the parents and the child is very poor, or we can term it as a very cold relationship. The parents who discourage autonomy in the children, who don't give independence for the child, who seem to be overprotective. In such kind of a parenting behavior, the child may end up with the anxiety disorder, wherein the fear of leaving the loved person or the parent can contribute to the anxiety and fear. If you take the attachment relationship between the parents as well as the child, which seems to be insecure or anxious style of attachment, can contribute to the feeling of being alone as well as resulting in the chronic anxiety. The next one is a locus of control. Here, the locus of control is the child's thoughts and ability to control his own environment. So, if the child is not learned or has not got the ability to have a locus of control, that may be because of the poor parenting pattern, which contributes to the separation anxiety disorder. So when the child is exposed to any kind of the environment, it's very new, the child is not able to adapt to the environment, adjust to the environment, can lead to the fear as well as anxiety. Parental behavior such as being very overprotective and intrusive. Genetics has found that the parents who are suffering with any kind of the anxiety disorders themselves can also predispose the child, or the child is at risk of developing an anxiety disorder when the parents even have anxiety disorders. So that is about the biological factors that can contribute to the anxiety disorders. Moving on to the temperament of the child. The temperament of the child can also affect in the development of the separation anxiety disorder. Children who are very much timid and shy, wherein the behavior is termed as behavior inhibited temperament, wherein the child will experience the anxiety in situations which are not familiar for the child. It can be the location or the person themselves. So in such situation, the child seems to be very much timid as well as shy. That is the temperament of the child, which can contribute to the separation anxiety disorder. So that is about the etiology. Moving on to the prevalence of the separation anxiety disorder. This kind of anxiety disorders are more common nowadays, especially seen in the youth, wherein we got the prevalence rate of 5 to 25% in the children in the worldwide prevalence rate. Of all the anxiety disorders, that is 5 to 25%, the separation anxiety disorders seems to be a larger proportion when it comes to the diagnosis of the anxiety disorders. It accounts for about 50% of the anxiety disorders which are noted in the young or the youth period is belonging to the type of separation anxiety disorder. So that is the prevalence of this disorder. Moving on to the symptoms or the clinical manifestations, the child may have an unrealistic and lasting worry that something bad would happen to the parent or the caregiver if the child leaves. And also, the child may experience that something unrealistic or a lasting worry would happen that will happen to the child, he or she leaves the caregiver. So both the conditions, the child may experience the anxiety or lasting worry, that is if the parent leaves the child or if the child leaves the parent, the child may have a kind of a fear that something bad will happen to him. The symptom that refusal to school in order to stay with the caregiver, that is another important symptom that you can note. Always the child will cling on to the mother or to the caregiver, not even going to school. The next is the refusal to go to sleep without the caregiver being nearby or to sleep with him, right? Even as a fear to go to sleep because of the fear that the parent or the child or caregiver may just go away, right? The next symptom is fear of being alone. You may have nightmares at being separated from the caregiver, bedwetting, complaints of physical symptoms such as stomachache or headache on school days, repeated temper tantrums that the client may have, or pleading behavior, clinging on to the child caregiver. So all these are the clinical manifestations. So even you can notice on the story which I told you about the 11-year-old boy. So he had complaints of separation when he went to a school camp, wherein he experienced severe anxiety that he even vomited, and he had difficulty in his sleep, wherein he used to have nightmares when he was around 5 or 10 years old, where he had nightmares about the mother leaving the child, or he would always feel that when he's separated from his mother that there's something bad would happen to his mother. So these symptoms are similar to that what the boy had experienced. Moving on to the treatment modalities, what are the treatment modalities which are available? We have got the non-pharmacological treatment methods. So these kind of non-pharmacological methods, which includes the counseling or the psychotherapy, should be used before even you start the psychopharmacological agents, especially because the age group is the child or children. So we don't put the child on the pharmacological agents immediately. We do try the other therapies. If not working, then we may start up with the psychopharmacological agents. So the therapies which includes are the play therapy. So it is an effective way of dealing with the client wherein the children or the kids can let out their emotions through the play. Okay, they can reveal their thoughts or the feelings through the play, which is really important to understand the cause, and it will be effective for the diagnosis as well as the treatment through the play therapy. So that is one of the important therapies that you are going to give for a child with separation anxiety disorder. The next psychotherapy is the behavior therapy. So in the behavior therapy, we use the technique of exposure. So the technique of exposure therapy is done. Other techniques like systematic desensitization, emotive imagination, or the guided imagery. You'll be asking the child to participate in the various behavior techniques like modeling, contingency management, wherein the child are really forced to go to school, and eventually when he is exposed to this force of going to school, that behavior of separation anxiety will be decreased. Okay, so these are the behavioral techniques that can be helpful for a child with separation anxiety disorder. Moving on to the contingency management, what is this? So it is a very important treatment modality which is found very useful in the younger children suffering with the separation anxiety disorder. It involves something like giving a reward to the child in the form of a verbal appraisal or a tangible reinforcement when the child undergoes acceptable kind of the behavior. When the child is undergoing this contingency management, if the child shows the signs of independence, they may be given a reward or a praise. So that is what is done in the contingency management. The next therapy is the family therapy. Very, very important. Even the parents are to be counseled. They will be anxious about the child's behavior. So very, very important related to the parental guidance, right? So how should be the parental behavior? What kind of a parental, behavior that the parent should have when they are dealing with such a kind of the child will be taught in the family therapy. The family therapists are going to do the assessment of the family. They're going to rule out what may be the cause in the family which is contributing for the separation anxiety disorder. The next therapy is a cognitive behavior therapy. You're going to do a cognitive behavior therapy to rule out the reason for the anxiety and also to reduce the feelings of the anxiety through the practice of exposure therapy, by exposing the client to the anxious producing situations. This is even going to reduce the thoughts, that is the negative cognition about the anxiety. So that is what you are going to expose the client to a cognitive as well as the behavior therapy simultaneously to bring about a modification in the thought as well as the behavior. So these are the various non-pharmacological therapies that you ask the client to undergo with a separation anxiety disorder. Moving on to the second option, which is a pharmacological therapy. If the separation anxiety disorder is very severe and if it is very extreme to such an extent that all the non-pharmacological treatment option fails and the child is typically refusing to go to school, then we opt for a pharmacological therapy wherein the drugs such as the selective serotonin reuptake inhibitors are being used. The anxiety medications are used to bring down the anxiety and fear in the clients. Okay, so that is about the treatment options available. We have got the two options, non-pharmacological as well as the pharmacological treatment. So this is about the condition separation anxiety disorder, which is usually seen in the children because of the fear of separation from a parental figure or a caregiver or a loved person, wherein the child can be given the various therapies to bring about a modification in the cognition as well as the behavior so that he will be able to manage the anxiety level. Hope you all have understood the topic. Thank you.